The gap has widened, and the ones in the high-income countries are the ones that are getting the best access to care. The individuals in the low and middle-income countries actually still are in similar conditions that were 20 years ago.
So there's an enormous inequality, an enormous disparity in access to palliative care and pain control between rich and poor countries.
We have done great strides and wonderful improvements in high-income countries. And they have a strong drive, they have strong associations, they have the resources, and they have done beautiful jobs. They're publishing, they're doing research, they're driving the agenda in amazing ways. But we have failed to bring those resources and enabling the individuals working in the low and middle income countries to the same degree.
The problem is that there's an enormous amount of suffering that's unnecessary.
So in children's palliative care, we know that there's about 21.6 million children globally who need palliative care. 8 million of those need a specialist palliative care, and yet people don't know about the problem.
Palliative care and pain control are not readily available in the developing world, and the mission of IAHPC is to change that, is to make sure that people do not have to suffer unnecessarily.
Of course, the mission talks about access to medications, education, policy, implementation of services, but it's all to relieve suffering and increase the quality of life. The ones in the high-income countries don't have a lot of the limitations that individuals in the low-income countries have. And there's a lot of learning there because they have to cope with challenges, shortages of medications, shortages of personnel that high-income countries don't face.
Practitioners and providers need controlled medicines in order to do palliative care, such as morphine, and they're unavailable in more than 75% of the world.
It is frustrating and heartbreaking to see patients suffering because of the unavailability of a simple cheap drug like morphine.
The real problem is that the health system is cure-focused instead of care-focused.
And I wonder if Jose wasn't feeling that sense of inferiority because he is not curable. And I wonder if the system is set up in ways to make this happen. Now, another quote from Dr. Martin Luther King says, "We have a moral obligation to disobey unjust laws." And I wonder if we don't have a moral obligation to challenge unjust systems, stand up to these systems.
I think IAHPC has been extraordinarily inventive over many years to try to find any way to change things.
We go along with these big regional congresses and support the regional associations in these congresses by bringing in people who otherwise couldn't come because they don't have the funds.
I think the best way to improve palliative care in the world and mainly in developing countries is through education.
Our traveling scholarship programs provide funding for individuals mainly from developing countries to attend any kind of educational activity. It can be a conference, a workshop, it can be a university program, just basically to continue their education in palliative care.
Being a member of IAHPC, I have been able to travel in different countries through the scholarship that I've been receiving.
For us it's very important to have more knowledges and communication with others. It strengthens us.
This organization gave me a very unique opportunity to take part twice in congresses, and I'm particularly thankful to organizers.
I would like to pray and just hope that this kind of support is maintained and even made better for people like me to benefit from the traveling scholarships. I know so many people who would have loved to come but couldn't come because they didn't have the means to make it here. So I'd like to say thank you so much and pray that that continues going on and on.